I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. I recently sat down with Dr. Lorna Marshall of Pacific Northwest Fertility to talk about egg freezing. In part 1, which you can hear on Geneve.com, Dr. Marshall gave us some of the history, science, and challenges around fertility treatments such as IVF and egg freezing. In this part of our conversation, we talked about how cultural factors have changed our approach to family planning. Is egg freezing a way for young women to have it all? So in the past 4 years, has the number of women who are thinking about family planning and coming in to talk to you about proactively, like just shot up through the roof?
Yes, it's shot up through the roof. And it's been fueled by some companies offering elective egg freezing as a benefit, not necessarily truly a medical benefit, but for example, Facebook, Google, and a few other companies now are getting on the bandwagon to offer it as sort of a fertility option, but also as a benefit for women.
Which is an interesting, you can argue both sides of that benefit. But it certainly sets a new option and path forward for female workers.
Right. So I think at first when in 2013, when egg freezing became non-experimental, that more of the women who came to us were older. They were late 30s, early 40s, maybe too late to freeze their eggs, who said, gee, I'm 43 and I want to save my eggs for when I'm ready to get pregnant. And it was so hard for them to hear from us that they probably were already too late to freeze their eggs.
And that's really case by case, right? Do you still, like, if I'm 43 coming in to talk to you about that, do you still take a look at my eggs?
Sure. We would take a look at you and we'd sit down with you and find out what your goals were and maybe if there's some way we can meet them. Certainly a woman in their well into their 40s is best served by donated eggs to conceive.
I see.
And not well served by using their own eggs. Most women have very few remaining eggs in their 40s, and the percentage that are healthy is much lower than it is for younger women. So really the best concept is to think about doing donor egg. I think the press has not helped this situation. So many of the movie stars who say, gee, isn't it wonderful to be pregnant when I'm 45, 46, 47, all of those women conceive with donated eggs. But for privacy reasons, they're not willing to broadcast the fact that they conceive with donated eggs.
Yeah.
The Janet Jacksons and many, many others who are in those.
But rather the notion that freezing was the option that they used, and it's got this incredible success rate.
Well, partly that, but partly also some people just believed that they were still fertile and that they went to an IVF clinic and they used their own eggs and got pregnant. Once egg freezing came out, then we're starting to hear that, they must have frozen their eggs when they were younger. That's why they can get pregnant now. But still, a lot of women still believe they can conceive in their late 40s, and that can happen, but it's not very common.
Yeah. So when someone comes into you to talk about egg preservation, what do you say in terms of, okay, these are the pros, these are the cons, or these are the risks, and this is the upside? Like, what would you say to a woman?
So what we usually do is first offer them some testing to see what their egg supply is, because there is a wide variation in the egg supply of women who are in their 40s. Some women actually still produce a fair number of eggs, and some women have a very, very low egg supply. So if a woman has a very low egg supply, and we're pretty sure we won't really even be able to stimulate the ovaries to get multiple eggs, we strongly discourage them from considering this as an option.
And how do you test for that?
We do some blood tests, and we do an ultrasound. So the blood tests that we do are an FSH, which stands for follicle-stimulating hormone, and that is a hormone in the pituitary gland that goes sky high when women run out of eggs, when they're menopausal. So it may be up in the range of 30, 40, 50 or more when a woman reaches menopause. But what happens, what we've learned, is that when it's measured on the second or third day of the menstrual cycle, that it just creeps up ever so slightly as women age and as their egg supply diminishes. So we like it to be less than 10, but if it's up in the range of 12, 13, 14, up to 20, then we can conclude that it's likely that the egg supply is fairly low. Mm. We also have a newer test called an AMH, which stands for anti-Mullerian hormone, not malaria as in mosquito malaria, but Mullerian, Mullerian, which is produced by the ovaries. And that number is higher when women are young and becomes lower as they get older. So a low level of that predicts, we believe, a low number of eggs, and a high number predicts a high number of eggs. So the best scenario is to be young with a high AMH, right? The worst scenario is to be older with a low AMH.
Yeah. Yeah.
So the irony of the whole thing is that as you get older, you have fewer eggs, but you need more to establish a pregnancy, or to feel comfortable that freezing your eggs would have a good chance of resulting in a pregnancy later on down the line.
So what are those chances? Like, let's say I'm 39 years old and my AMH test came back pretty good. What are the risks? Like, how do you set my expectations in terms of my plan is to use my eggs in 3 years? Mm-hmm. You know, do patients get that precise with you? And then how do you prepare them for?
They definitely are precise in their questions, but we can't be very precise in our answers.
Okay.
Because we just don't have enough information to be that precise. The best we can do is say, look at their age, look at the number of eggs that they actually get in an IVF, not an IVF cycle, but in an egg retrieval, and give them some sort of general idea of whether it's enough or not. We also have to look at their goals. Like some women come to us and say, well, I will only have a child once I meet a partner. And so in that case, you're sort of like, okay, so we have no idea when that's going to be. And how many children do you want? Do you want 1 child, 2 children? So we have them think through what future they want. And also, well, gee, if you meet someone and you don't get pregnant, would you do egg donation to conceive? And if they feel like, sure, I would do that as a second chance, as a second choice, I would move forward and do egg donation. It's not my first choice. And then, but I really would like to at least try with my own eggs.
Yeah.
But we also have some women who come in and are just like, this has got to work. I have to have a child with my own eggs. I will do whatever it takes. And those women need to consider doing these procedures more than one time, several times, if they want to have enough eggs that they have a greater amount of certainty that they will.
So the certainty is really based on the amount of eggs versus, like, can you freeze them? Does the amount of time frozen impact the quality of the egg?
We don't think so. At this point, we don't have any evidence that it does. We think that when we freeze eggs, that that's a stress to the egg. Thawing an egg is a stress to the egg, and pretty much nothing happens in between. We have good evidence, we believe, that in the old methods, the slow freezing methods, that really nothing much happens to an egg in that period of time. So it doesn't really matter whether the eggs are frozen for 5 days, 5 months, 5 years, doesn't really matter. With the process of vitrification, there still is a little question. We don't have proof that the eggs will be fine in 20 years. No one has ever vitrified an egg and then warmed it and inseminated it, created an embryo, and created a baby. After 20 years, it hasn't been around that long. We don't know that. There are some people who think that vitrification may result in eggs that are at a little greater risk of maybe some sacrifice to their quality with time, because they have to be completely submersed in liquid nitrogen during the entire time. And in the process of just checking your inventory, you have to open the tanks, close them, and you have to be really, really careful with vitrified eggs to keep them submerged. So we think probably they're fine, but we don't know that.
Yeah.
We don't have proof of any of those things.
Now, you mentioned that you have a large egg bank.
Mm-hmm.
Where do you store them? Is it's in a big room, and is it like walking into a walk-in freezer, or what's it like? Can you describe it?
They're big tanks. They're
everywhere.
4 feet around, the big cylindrical tanks, and they have little canes in them that have the embryos stored in them. And we have thousands of embryos stored. We have sperm stored. We have eggs stored. You can store a lot of eggs and embryos in a small space, but there still is a limit to that. And there are a lot of fertility programs that don't store their eggs in their embryology lab, and they have the women ship them off to long-term storage facilities. So there are several of those in the United States where they charge a little bit lower fees for long-term storage.
I see. And let's talk about money. Mm-hmm. This is incredibly expensive, or mm-hmm. that's kind of that. What can you give us a sense of what a woman should expect?
So I can tell you exactly what to expect from our program. So for a woman who comes to us for elective egg freezing, that it is about $9,000 to do your first cycle, and we have a discount the second time around, so it's like $7,500 to do that. That does not include the medications that you need, which can be $4,000 to $6,000.
Wow. And typically the medications are not also insured under many plans.
That's correct. So you're talking about $14,000 to $15,000 for one egg freeze cycle.
Wow.
And it's important for women who do this to know that isn't the cost of establishing a pregnancy, because what has to happen is when you come back to use the eggs have to be thawed, inseminated with sperm, and then the embryos have to be incubated for usually 5 days or so before they're transferred. So, and that's a significant cost too. So that adds cost to the process. Depending on when it's done, I guess that will determine how much it will cost. But that's not, so the $14,000 or $15,000 isn't the end of it. There also are storage fees. So the storage fees here are about $500 a year. So you're $40, $50 a month to store your eggs.
Yeah. Wow. So it's not a decision that women make lightly.
No, it's not. Mm-hmm. There are very few women who are 28 years old who have this kind of money to put forward to freeze their eggs.
Yeah.
And so right now it is true. It is something for elective egg freezing. It is something that, certainly only those that have either good insurance or other resources to pay for it can afford.
Yeah.
For cancer patients, we're hoping this is changing. So we give as big of a discount as we can give in our clinic for the services, and give a 25% discount for our patients who come to us who have cancer that want to freeze their eggs. There are some of the pharmaceutical companies or fertility pharmacies that provide medications free of charge to cancer patients. So that reduces the cost substantially for these women who, suddenly they're faced with the diagnosis of breast cancer and have to take time off of work and et cetera, and pay for their medical bills. And so it's nice for them to have a much lower burden of doing this. There has been a move in state legislatures to require insurance companies to pay for fertility preservation, which is not just egg freezing, but also embryo freezing. If the woman who has a diagnosis of cancer has a partner, it could be embryo freezing. Rhode Island just recently, within the last month, passed a bill that requires insurance companies to cover fertility preservation for cancer patients. And I actually believe it may extend to patients that have other medical diagnoses that might require fertility preservation because the treatment's going to damage their ovaries.
Yeah, I was going to say there is other
Sure.
things out there as well that
Sure.
beyond cancer.
Sure.
Unfortunately.
So that's exciting.
Yeah.
The issue of insurance companies paying for elective egg freezing is going to be more like a benefit, like we talked about, and
Yeah.
it's probably still going to be something that's really only available very electively.
Yeah.
I read that there was a town in Japan that decided that they wanted to increase their population, and so as part of that mission, they decided to pay for a large portion of elective egg freezing for the women of their community.
Wow.
Is that fascinating?
That's fascinating.
That's fascinating.
What do you love most about what you do?
Wow, that's a hard one. I love the day-to-day interactions with the patients, and I've never tired of that for all the time I've been doing this. But I also love its fluidity. This has been just fascinating over the years, and I feel like even though I've been doing this for a long time, it has continued to change and continue to be interesting from both a scientific standpoint, but also from social, ethical standpoints. I feel like I'm sort of in the heart of society doing this. It is a very hard job to do from a day-to-day basis because, like I tell my children, it's a job where every day I'm successful and every day I fail, or I feel like I fail.
Yeah.
Because I see patients who don't realize their goals.
Yeah.
And so day to day it's exhausting, but over the long run it's highly rewarding.
Yeah. That's just, it's really quite a magical gift you're able to help people get in the end for those that are successful, which is really wonderful.
Yeah, I had the opportunity to meet Louise Brown actually just a couple months ago at a meeting that was in Chicago. And I chatted with her, and part of my conversation with her was I thanked her for giving me the career that I have.
That's fantastic.
I said, you know what, you are responsible for all of us having one of the most fascinating, rewarding careers that you could possibly have.
Yeah.
It's
amazing, again, how young egg preservation and egg freezing and the acceptance of it really is. I had no clue. We're still just in the it's
very young, and one of the things that we try to educate our patients about is that not every fertility program can freeze eggs. It's important for individuals who are thinking about freezing their eggs to do their homework. For example, because we were committed to caring for cancer patients, we started vitrifying eggs in 2009, and we started a donor egg bank in 2009 under an experimental designation. By January of 2013, we'd already had 100 babies born from frozen eggs. So when we started electively freezing eggs for women who were coming to us, we had tons of experience freezing eggs and thawing them and making babies. So when this experimental designation was lifted, every fertility program in the country jumped on the bandwagon and said, we can freeze eggs. But they didn't have the experience of thawing them and making babies. So I do worry a little bit about women doing their homework. And I hate for them to go to a program that has no experience really thawing eggs and making babies from the eggs that they have frozen. I worry about them going to those programs to freeze their eggs, and they have false reassurance that they are going to have a child from those eggs when that really might not happen.
What do you recommend in terms of homework?
Well, I think that when they go to a program, they need to say, how long have you been freezing eggs? How many eggs have you thawed? How many babies have you had from thawing your frozen eggs? And also, have you frozen eggs for anyone in my age group? Right? And that's one place where we can't really even tell people we have a lot of experience. We've had now between 200 and 300 babies from frozen eggs, but most of those are from eggs that were frozen for women who were ages 21 to 31. So we even, though we have some of the most experience in this area, we still don't have a lot of experience thawing eggs from women who are 38, 39, 40, we really can't tell those women what their success is going to be.
Just because it really hasn't been around that long.
It hasn't been around that long.
You don't
4 years is not enough time.
Yeah. It's incredible.
Yeah.
Anything remaining you want women to know or that we haven't talked about?
There was a study from Boston where they actually just modeled the chances of success based on a woman's age and the number of eggs that were retrieved. And so some of those numbers are sort of interesting. So for example, if you're 30 when you do this and you have 5 eggs retrieved, they modeled that it would be about a 44% chance that you would be able to have a child. But if you're 40, it's about a 16% chance.
Wow.
If you have 10 eggs retrieved, maybe 69% if you're 30, and down to about 30% if you're 40. So the concept is that your age and the number of eggs that are retrieved is probably your best determinants of what the chances are that you'll be able to have one child with your frozen eggs. But injected in there is what we're learning more and more now, is that particularly as women get older, the percentage of normal embryos varies widely from person to person. So that success rate still has a lot of variables in it that are unpredictable.
Yeah. Well, Dr. Marshall, this has been fascinating. You are a pioneer in still a very young and new field, and I just want to thank you for sharing what you're learning and what you're doing every day with us and with our listeners.
You're so welcome.
Thanks so much for joining me for my talk with Dr. Lorna Marshall. Up next, I talk with Dr. Susie Gronsky, Doctor of Physical Therapy and Certified Pelvic Rehabilitation Practitioner. She's your doc for everything down there, she says, and she'll be talking about healing pelvic pain and enjoying sexual wellness, even post-menopause. Be sure to join me. You won't want to miss it. Thanks for listening to the Geneve podcast series. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Geneve podcast series is produced by Shannon Perry, theme music by Smitty. And until next time, watch the Geneve website for new stories and offers all dedicated to women's midlife health.